We're back with Good Health tonight, and as the coronavirus continues to spread in China, health officials are racing to learn as much about it as possible.
Yeah, and we know our viewers have a lot of questions as well. Dr. Frank McGeorge is here with answers to some of those questions that we're hearing most often here.
Yeah, Kim and Jason, and here's the thing, some of those answers are changing from day to day as researchers study the virus and the people who've already fallen ill. Here are some of the frequently asked questions and what we know so far.
First things first, what is a coronavirus anyway? Well, coronaviruses are a family of viruses that include the common cold, SARS, and MERS. The name corona comes from the Latin word for crown because the virus resembles a sphere with spikes on it under a microscope. What are the symptoms of this coronavirus? Are people contagious before they get sick? Well, symptoms of the new coronavirus include fever, cough, and difficulty breathing. Doctors have noted that unlike SARS, this new virus does not cause a runny nose, sneezing, sore throat, or diarrhea. So when are people contagious? Well, that's still unclear. Over the weekend, Chinese health officials said patients may spread the virus before they show symptoms. U.S. health officials say they've seen no scientific evidence to support this. A very important question, how deadly is this virus? Well, the answer is we don't know yet. An early estimate put the fatality rate around 2.9%, compared to around 10% for SARS. Another big question, why is there so much concern about this virus? Doesn't the flu kill more people? Well, yes, we already know the flu sickens millions and kills several thousand Americans each and every year. The flu is currently a much bigger risk to Americans, but new viruses are concerning because we don't have vaccines, tests, or treatments for them. There's also the possibility a new virus will mutate and become more infectious or deadly. Now finally, is there a risk of coronavirus from items being imported from China? Well, probably not, because coronaviruses in general only survive a few hours on surfaces. The CDC says there is likely a very low risk of spread from any products that are shipped from over a period of days or weeks from China.
Now other people are wondering, how do you treat this virus and is there a vaccine? First of all, there is no specific treatment for coronavirus, so doctors are focusing on treating the symptoms. In severe cases where patients might develop pneumonia, they're being given oxygen or put on a ventilator. Now, China is testing whether two drugs used to treat HIV may also be helpful against the virus, but that remains to be seen. Now, as for the vaccine, there isn't one yet, but researchers at the National Institutes of Health are in preliminary stages of developing one, but it's going to be many, many months before that's even close.
Yeah, and still a lot we don't know. We're trying to figure out.
Exactly.
So
very dynamic, day-to-day changes.
All right. Thanks, Doc.
We want to send a big congratulations